All right, guys, this is Drew again, back with another recording. You can kind of just probably ignore my face here since these seem to be lagging a little bit. Um, but we're going to walk through this time question 85 of the Free 120, the current Free 120. And like I always say, I'm going to start by reading and highlighting the last sentence here, which is the most appropriate pharmacotherapy in this patient most likely has which of the following mechanisms? So I'll go ahead and say that they love to tell you that you're never tested on treatments or drugs on step one. You'll hear that a bunch of times, but the true answer is you're going to be. I mean, this is clearly a what type of drug do I give this person, just worded differently. So if we take a look at the answer choices, which is what I always like to do after I look at the last sentence of the question, it's basically looking like some neuro slash psych mechanisms. And it's going to be a mechanism of action of the drug. So that's what we're going to want to keep in the back of our mind. So let's read the question. A 48-year-old man comes to the physician requesting treatment for alcohol withdrawal. He reports a 30-year history of consuming 6 to 10 beers daily. He has had two citations for driving while intoxicated. He has previously experienced alcohol-associated seizures and withdrawal symptoms. His vital signs are within normal limits. A physical examination shows palmar erythema. Okay. So why did I highlight what I highlighted? So right away, it kind of tells you the gist of this question, which is he's requesting treatment for alcohol withdrawal. Now, that's, basically they give you some of this other information just to prove that he is an alcoholic or he has alcohol use disorder with a 30-year history. That's a pretty significant history of beer drinking. They threw in the citations while driving just to prove the point that it is hindering his, activities of daily life. He has also had some alcohol-associated seizures and withdrawal symptoms, possibly delirium tremens. Now, this sentence might be trying to throw you off just a little bit. Um, for you know, there are a couple different mechanisms that different drugs that could be associated with treating delirium tremens, and then you have your ones that treat alcohol use disorder. So we just kind of have to keep that in mind. Um, and then physical examination showing palmar erythema. So that is usually a liver associated finding, and that is just telling us that, hey, his alcohol use has gotten to the point where it's affecting his liver function now. Um, so, once again, connected to his alcohol. So we have to keep in mind here that he is requesting treatment for alcohol withdrawal, not alcohol use disorder treatment, because I'm not sure if it's in the answer choices here, but for alcohol use disorder, we use a very different set of drugs. We can use things called naltrexone or a camprosate. And less often, you can use disulfiram. But that's for alcohol use disorder. This is alcohol withdrawal. And anytime you have alcohol, and he's presumably requesting withdrawal treatment because he doesn't want to go through these seizures and withdrawal symptoms again. So the way that you treat alcohol withdrawal or delirium tremens, seizures, anything related to alcohol is you use typically benzodiazepines, or you can use barbiturates as well, but benzos are preferred. So we're going to try to find the benzodiazepine in this answer box. So first one here, blockade of dopamine receptors. That is going to be your antipsychotic mechanism of action. So we're not going to use an antipsychotic for this man. B, so decreased activity of dopamine transporters. This is going to be like dopamine reuptake inhibitors. This could be like stimulants or cocaine. You're not going to give a patient that. The enhancement of the effect of postsynaptic GABA. This is the key here. This is the mechanism for benzos. And remember, benzos and barbiturates both act on GABA. One of them is the duration, and one of them is the frequency of the basically the chloride channel for GABA opening. So we just need to remember the difference there. Increased GABA transaminase. So paradoxically, if you increase transaminase, this would decrease GABA. We don't want that. We want to increase GABA. Inhibit glutamate. Those really not a lot of evidence in terms of mechanism of actions for these drugs. There's a couple that can do this, such as like anti-epileptic drugs, levetiracetam, but that's not what we're going for. Inhibition of serotonin. These are going to treat your depression, anxiety. It's like SSRIs. No. Opening of glutamate channels. This is going to be NMDA receptor agonist. We're not looking for opening of glutamate. We're trying to stimulate GABA. And then stimulation of 5-hydroxytryptophan receptors. These are going to be serotonin agonists, such as triptans, which essentially can treat migraines. So guys, why do we want to so our answer is C here. Why do we want to, it's just a clinical cue here. Why do we want to increase GABA? What does alcohol do? Alcohol is a depressant. So GABA is your inhibitory neurotransmitter. Glutamate is your excitatory neurotransmitter. So alcohol actually increases GABA. So if we're withdrawing from alcohol, that means that we haven't had alcohol in a little bit. So our GABA is actually paradoxically decreased. So in order to kind of treat that withdrawal, we want to, you might not think that it would work, but we actually give them something to increase GABA again. So that is where your benzos come in. And that is it for this question.